Alicia.
I'm Molly.
And I'm Soleil.
So thanks for being here. Today we're looking at inpatient falls and how structured hourly rounding can reduce them. This is a big issue in healthcare because falls are considered a nursing sensitive indicator and are linked to patient injuries, longer hospital stays, and overall increased cost.
And because of that, there's organizations like the Joint Commission and Centers for Medicare and Medicaid Services that have made fall prevention a major priority. And it is something that hospitals are consistently being evaluated on by them.
One of the problems we focused on is that rounding is not always consistent. It can vary between the nurse, the shift, and the unit. And when that consistency isn't there, patients aren't being monitored as closely, which can increase their risk for falling.
So based on that, we developed our PICO question. We asked whether structured hourly rounding compared to inconsistent or less frequent rounding reduces falls and improves patient safety in adult acute care patients.
That question has guided our entire project and helped us stay focused on what actually impacts the outcomes.
When we started reviewing the research, one thing became really clear. The evidence is strong and pretty consistent.
For example, one study showed that about 21% reduction in falls with hourly rounding, and this is pretty significant.
And another finding was that poor nurse communication had increased fall risk by over 8 times. So communication alone plays a huge role in patient safety.
And across multiple studies, we saw the same patterns. Better patient monitoring, improved communication, and overall safer outcomes when rounding was done consistently.
Another major theme was that single interventions aren't as effective on their own.
Right. And multifactorial nurse-led approaches worked better. That includes things like patient education, environmental safety checks, and individualized care planning.
We also saw that staff education and engagement are critical. If the nurses don't understand the process or aren't consistent with it, then the intervention doesn't work as well.
So when we put everything together, 3 main takeaways stood out. Structured rounding reduces falls, communication is essential, and combining strategies is more effective than relying on just one.
And the biggest factor tying all of this together is consistency.
So, based on the strength of the evidence, we decided that a pilot implementation would be the best next step.
And instead of immediately rolling it out everywhere, starting small allows for adjustments based on real-world use.
It also helps identify barriers early before expanding this to other units.
From there, we developed a few key recommendations. First, implementing structured hourly rounding using the 4 Ps: potty, pain, position, and possessions.
Second, continuing to use multifactorial interventions like patient education and environmental safety checks.
And the third is making sure communication during the rounding is consistent so that patient needs are not missed.
For next steps, we would pilot this on one inpatient unit.
That would include developing a standardized rounding protocol and providing staff training.
And we'd also want to make sure that there's consistent documentation in the electronic health record so that we can track the outcomes accurately.
Then we would monitor the fall rates and the patient safety outcomes before deciding whether to expand the intervention to other units or not.
And when it comes to sharing the results, we would target both internal and external stakeholders.
Those internal stakeholders would be nurses, educators, and the unit managers.
External stakeholders would include the leadership and patient safety committees.
We would share findings through staff meetings, education sessions, posters, and email updates.
The barriers that we foresee would include time constraints and inconsistent adherence.
But the strengths far outweigh the barriers. There's strong evidence and likely support from leadership on this topic.
So overall, this project really showed how evidence-based practice directly impacts patient outcomes.
And the biggest takeaway is how important communication is, not just completing the task, but actually engaging with patients along the way.
It was also interesting to see that while the hourly rounding does help, the outcomes for a patient's safety are even stronger when multiple strategies are combined.
And ultimately, even the best interventions don't work.
Unless they are implemented consistently
And supported across the entire team.